Alright, BSI, scene is safe. Got dispatched to call for a fall, otherwise no information. Gonna check my patient's level of response as well as chief complaint when I make contact. Because of the MOI, we're going to take C-spine precaution for this individual. General impression of the patient is that they are supine, laying in the grass from a roof overhead. With that, they seem to be unresponsive, but again, I'll make contact and determine my patient's chief complaint level response. Hello, hello? Are you okay? Are you okay? All right, my patient's unresponsive. I'm checking for a pulse. I have a pulse. Breathing, I see adequate chest rise, chest fall. I'm gonna look inside the patient's mouth, looking that it is patent. All right. With that, we're gonna say the airway is patent. Now we're gonna feel for adequate chest rise, chest fall. We'll auscultate breath noises now. Lungs sound clear, equal bilaterally. We're going to perform a blood sweep now. Looking for any signs of blood down the invisible arm, the other invisible arm, the torso, down the pant legs, to the foot, other pant leg, to the foot, clear. Feeling for a radial pulse, present, which means we should also have a carotid. Carotid is also present. From here, we'll look more into the skin color, temperature, moisture. Patient feels cool to the touch, otherwise pink and dry. With that, we'll move into a better assessment. Again, my silent partner's has C-spine. I'll also have my other partner grab a set of vitals and a patient history if there's any bystanders or family members that can get it for us. With that, we'll go into a formal head-to-toe assessment, working from the head, palpating around the eye sockets. The nose is intact. Any blood, CSF, bruising, no. Looking at the pupils, they seem to be round and reactive to light. Looking in the ears, behind the ears, looking for blood, bruising, CSF. I don't see any. We'll move to the mouth or the mandible. Intact in one piece, getting a better look inside, seeing if any teeth are dislodged, any blood, CSF, anything that would compromise that airway. We'll see that the trachea is in line. We're feeling no jugular vein distension, but we do still have a carotid pulse. We'll palpate cervical spine now, process by process, looking for any deformities, contusions, abrasions, avulsions, lacerations, or anything of the like, or pain on palpation. Still, my patient's unresponsive. Exposing the chest, we'll feel the clavicle intact. Again, we'll press in first, down. We auscultated before, we'll auscultate one more time. Again, clear, equal bilaterally. Sternum is intact. Try the abdomen quadrant by quadrant, feeling that it is soft, non-tender, easily palpated. Pelvis, pressing in first, seeing that there's no instability or any deformities. Now we'll press down. Again, pelvis is stable. Checking genitalia, no massive bleeds. We'll work down the leg, the femur, the knee. See that the patella is in place, have good range of motion. Work down tibia, fibia, ankle. Do I have a pedal pulse? Yes, good range of motion. All right, we'll work down the other leg. Again, patella, good range of motion. Femur felt intact, no deformities. Keep it moving down, tibia, fibia, down to the ankle, to the foot. Pedal pulse. Yes. Sir, can you feel this? Sir, can you feel this? Sir, can you pull up on my hands? Sir, can you push down on my hands? Am I rubbing or pinching? 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 Patient still unresponsive. And we'll work down the arms. Radial pulse. Present. Good range of motion throughout. Again, no deformities. Other arm. Good range of motion. Radial pulse. Present. All right. From here, we're going to rotate to my side so we can palpate the rest of the spine as well as look at the flanks. So on my C-spines count, we'll move. 1, 2, 3. Excellent. Keeping sure to palpate all the way down. Looking at my patient's face periodically to see if there's any wincing, to see if there's any pain. Still none. Looking at the back, I see no deformities. Looking at the flanks, no bruising, no bleeding. Again, on my C-spines count, we'll roll back. 1, 2, 3. This patient is high priority due to their level of response as well as chief complaint being unresponsive after a suspected fall. With that, rapid transport decision for this individual. Lights and sirens, ALS, potentially getting another ALS provider to assist if we do need to stabilize this airway for this patient. Otherwise, treat for potential shock, as we did feel that they were a bit cool, but they still have a pulse. They still are breathing.